Well, many Americans look to the CDC, the Centers for Disease Control and Prevention, as COVID-19 spread across the country last year.
Indeed. At first, there were allegations about political interference from the Trump White House. And now, under President Biden, recent policy changes have been leading to some backlash and a lot of confusion. News Nation's Felicia Bolton spoke with the CDC's chief medical officer on what it's like to protect the health of an entire nation.
In the past year, millions of Americans turned to the Centers for Disease Control and Prevention to be a source of certainty in the midst of the unknown. Some felt the federal agency was not doing enough.
Can't you breathe better without an arm?
Others believed they were overreaching their power. Dr. John Brooks is at the center of it all. He's the chief medical officer for the CDC COVID-19 emergency response.
The CDC has been a guide to so many Americans during this pandemic, really informing us about what's going on. But you all have also faced scrutiny. What is it like working during this time?
I think we're always going to face scrutiny in public health. It's very difficult to please everyone. You know, we work for every citizen. And so we're trying to protect the whole public health. And it's always going to be controversial. I'll just say this, you know, it's hard to know when the right time to begin changing things is. It's easy in retrospect to always second guess what would have been the right time. But here's what we know now. We know now that vaccination really works.
During the pandemic, the CDC's recommendation changes for masking, vaccination, and social distancing became a focal point of frustration. Recently, they made a major recommendation, allowing fully vaccinated people to go maskless indoors and outdoors.
A lot of people were concerned about pulling masks a little bit too early, especially when there's not a way to verify if someone's fully vaccinated or not. What are your thoughts on that?
Having spent the last year trying to convince people to wear masks, I fully appreciate the hesitancy. And I want to just reassure people, first of all, that if you are fully vaccinated, the evidence is very clear. You are protected very strongly against this virus.
Since the pandemic, major leaders have stepped down, including Ann Schuchat, the second top CDC official, and first in command Dr. Nancy Messonnier at the beginning of May. Now Dr. Rochelle Walensky is taking the top position.
There's been some changes in leadership at the CDC. How are you all going to move forward?
Well, you know, there's always changes in any organization, and in our kind of an organization, when there's a change in the political leadership at the top of the country, it's often a time for people to consider their options.
After a year like none before, Brooks says the CDC's future is bright. Felicia Bolton, News Nation, Chicago.